Dr. Vidal, and we're here at Pure Plastic Surgery, back with Tuesday Tips. This is our weekly check-in. We meet every Tuesday afternoon to discuss different topics in plastic surgery, and I get to answer your questions. Today, we're going to be talking about postoperative swelling. The reason why we're going to be talking about this is because a beautiful, amazing patient of mine shared her progress week by week almost until her 6-week mark. And I want to show you what's normal post-op swelling and what to expect. I think this is a common area that people get very nervous, very concerned, especially by 3-4 weeks. They're like, why am I still so swollen? What's happening? They think there's something wrong going. So I'll go over what are the reasons for the post-op swelling, what to expect, and what things can help with the post-op swelling, okay? So what is post-op swelling? Swelling is going to happen anytime we have surgery or the body goes for a healing process. Swelling is the normal process for the body to heal. Basically, whenever we have a cut, wherever we have any trauma, invasion to the skin, to the soft tissue, to the fat, the body needs to send all the white blood cells, all the healing enzymes and cells that help promote the closure and coagulation and healing. And all of that is, it basically causes the blood vessels to engorge or dilate, and it causes the leakage of fluid. Why? Because all those cells need to go from the blood vessels to, it's basically traffic jam. They're trying to reach the areas they need to go. And there's something called cytokines that our bodies have, and cytokines are super important to get those membranes permeable, or like that fluid to get out and reach the areas that needs to reach to heal. But with all those cells comes the fluid. The fluid follows. It's the leakage of that fluid that causes the inflammation, okay? So it's normal and expected, and actually we need it to heal. So swelling, it's not bad. It's just uncomfortable, but it's needed for healing. So when is the majority of the swelling? So that first week is gonna be the worst. You know, that first few days after surgery, you're gonna be very swollen. And the swelling is not only in the surgical areas. You may experience swelling in other areas of the body, because the inflammatory response in the body is systemic. It goes everywhere. So all the blood vessels in our body is going to be dilated and permeating all those cytokines and inflammatory responses. So you may be swollen in the face. Like, it's very common for the BBL patients, especially because they're sleeping in their bellies, for their eyes to be very swollen, their cheeks, your hands get very swollen, the knees get very swollen, the feet. So it's like everywhere. It's like, I didn't have any surgery in my hands. Why are my hands so swollen? It's very common. It's completely normal. Your body's just going through that. So that first week is the worst. And this is my beautiful patient. She had a mommy makeover. And she shared with me her picture. So you can see here is the day before surgery, right? And then this is day 3, and you can see the amount of swelling. She had a tummy tuck, and she had breast lift procedure, and you can see the amount of swelling, especially very common with tummy tucks. The swelling is around the belly button, so you look very bloated, and also the swelling is around the areas of liposuction. And you can see from here to the 6th week how much change in her waist you see, and all of that is swelling. And you can see all this bulging. It's not excess skin, it's just swelling, okay? And for my belly buttons, I try to make the belly buttons as natural as possible, because I think it's a very key, important component to try to make the tummy tuck the best result possible. Try to make that belly button seem like you didn't have surgery. So the trick is to try to make the scar heal on the inside. So I put a lot of stitches on the inside of the belly button to try to bring it in, so the scar at the end ends up on the inside, like here. But you can see initially looks like it's pulled down, and it makes the swelling around it even worse. So this is all normal, very, very normal. The breast, look at how engorged they are. The implant looks very high. So all of this is normal, okay? You can see the swelling around the breast, swelling even around in the sides of the breast, and also in the areas of liposuction. You can see from day 3 to 2 weeks how much the swelling come down. You can see the belly button doesn't look as pulled in. The belly button, the belly here looks flatter. The waist has started to come in, but you can see, especially around the corners of the incision, how much swelling she still has. Remember that gravity is going to take a toll. So swelling tends to be improving in the upper part, but then accumulating in the bottom part, kind of like gravity pulling out. So the areas where I see that the swelling tends to linger longest is in the pelvic area, the lower abdomen, the areas on the corners of the incision, and if you had a BBL or a tummy tuck in the back, lower back area, that's an area where the swelling tends to take longer. So you see 2 weeks, a lot of swelling has come down, but still, and she still has one drain at 2 weeks, which is fairly normal. I put 2 drains with my tummy tucks, and sometimes I'm able to remove one by the week follow-up. She had one removed, but the second one was still there, okay? And you can see by 6 weeks how much of the swelling has improved, okay? The belly now looks a lot flatter. Look in comparison to the post-op day 3 photo. And also the sides. You see how in the 2 weeks out, how this bulges on each side and how smooth it is in 6 weeks. You can see also on the sides here how bulgy it was and how it's smoothing out and basically rounding on the lateral part of the breast, making that lateral contour of the breast a lot smoother. And also here, the breasts tend to look a little square. That's very, very normal after a breast lift. And you can see on 6 weeks how that roundness is improving, okay? She's only 6 weeks out. This is not the final result, okay? It's very important to understand that swelling will still be there, okay? Swelling doesn't come down linearly, okay? It's not like I'm swollen today, tomorrow I'll be less, and the next day I'll be less, and then I'm not gonna be swollen. No, it tends to go up and down, and when time passes, the up is not as severe swollen as it was, but it's still up from yesterday, for example, and it fluctuates a lot until it goes down to baseline, okay? So what is the usual post-op swelling I see? Post-op swelling is the worst the first week, a lot better by 6 weeks. 6 weeks is when you can see like, oh my God, the swelling has improved a lot, but I feel that some days I wake up and I'm super bloated, and then the next day I'm better. And you can see that fluctuation is very, very still present by 6 weeks. At 3 months, is when I say you're going to see closely to your final result. 3 months, most of the swelling have been gone. Those fluctuations that you see at 6 weeks are going to go down a lot, but still, you may experience those fluctuations, and still there's maybe some areas that you're going to see swelling. By a year is when you're most, like all the swelling has come down, and that final result is there, okay? And you shouldn't be experiencing those fluctuations by a year out, okay? So it's a process, okay? What are the things that we can do to try to decrease the swelling post-op? It's never going to be zero. It's never going to go away. It's like, I want to have a baby but I don't want to be pregnant. No, you have to go through the process, okay? If you want to have a baby that's yours, that has your DNA, you got to go through a process, okay? So it's similar to surgery. If you want to have that final result, you have to go through the process, and you are going to be swollen. But what are things that you can do? One is your diet, okay? Diet's going to be super important, okay? If you eat salty or high in salt, you're gonna have a lot of swelling. Remember, the blood, like I explained earlier, the blood vessels leak fluid. If you eat salty, that salt is gonna leak to the soft tissue as well, to the fat, to the extracellular space. Remember your signs there. Extracellular space. So it's going to go out. The salt goes out and the water follows the salt. So everything is going to go out and the swelling is going to be worse, okay? So low salt diet. Everything else you can eat, it's fine. Try to incorporate pineapple, bromelain, or arnica, and that helps with the swelling as well, okay? Bromelain pills and teas, try to wait 48 hours after surgery. They may increase risk of bleeding. Arnica is okay to take after surgery. Natural bromelain comes in pineapple, so that's why I advise patients to drink pineapple juice after surgery, because it helps with the swelling, okay? 2, compression. Compression is going to be key, okay? Compression for a tummy tuck is different than compression for a lipo case, okay? Initially, you don't want to strangle yourself, okay? With both procedures, there's some healing and the blood vessels need to kind of reestablish blood flow, okay? So the skin is healing and also the incision patterns are healing. If you put too much tension initially, you may cause skin necrosis. Burns from like lipo burns or also skin necrosis in the tummy tuck incisions, okay? So initially the first week compression should be for a lipo, a stage 1, and that I am gonna give it to you. You don't have to be buying or trying to shop for a stage 1. You're gonna wake up in your stage 1 that I'm gonna pick up the size, the correct size for you. And that's the one that you're gonna wear for a week, okay? And for tummy tucks, you're gonna be wearing a binder. The binder is like a wraparound with a Velcro. It needs to be tight enough that you have compression, but you shouldn't be pulling at the binder like that to kind of strangle. No, it's gonna cause blood supply issues and you can end up with skin necrosis, okay? The first week is not the time, okay? It's to decrease that amount of swelling, but you're not trying to remove all the swelling with the compression, okay? Compression 23 hours a day. It's gonna be for the first 6 weeks, okay? At 6 weeks, you lower it to 12 hours a day. So you're gonna rest the compression for 12 hours, 12 hours on, 12 hours off until 3 months. What about afterwards? Afterwards is completely up to you. Like I said, the majority of the swelling is gonna be out by 3 months. There's still gonna be some swelling lingering until 1 year, but you don't have to wear compression surgically after 3 months. There are a lot of people that feel more comfortable with the faja, feel that they want to waist train. Waist training is good to start at 3 months, so you can if you wish to. But from the surgery, you don't need the compression anymore. That initial post-op swelling is gone, so afterwards is up to you, okay? Massages. Massages are super important, okay? The massages are gonna help remove all that swelling, remove all the fluid, and make the skin retract evenly, okay? So I advise all my patients, lipo, tummy tuck patients, to start massages the next day, okay? So post-op day 1, you should start your massages. And there's this little math. I usually recommend 20 massages in the entire post-op course. This is for lipo BBL cases. Tummy tucks, mommy makeovers, usually 10 is okay. You don't need as many because the amount of liposuction is not as much. But for lipo BBL cases, usually 20. So this little math of 777, that's 21 total, is something to guide you. I mean, everybody's different. Everybody's gonna need different amounts of massages. This is just a guide, okay? Who can help you decide? Your actual licensed massage therapist, okay? They have, if you choose a licensed massage therapist that has good experience with post-surgical massages, they can help you decide, okay, the swelling is not as severe, you can start to wean it off. But usually, the first 7 massages, you should have 1 a day. So the first week, every day, you're gonna get a massage. The next 7, usually every other day, okay? You start to wean them off. Next 7, every other day. By the final 7 to complete, usually once a week, and then you can stop the massages, okay? Again, just a guide, everybody's different. And the number 1, most important, it's time, okay? Time is gonna take care of the swelling. This is just normal in the post-op process. Don't try to focus on the swelling, focus on your recovery. Focus on what things you can do to improve your recovery, but not on this swelling, on that swelling. Just let it be, okay? Continue with what you know that you can control. Massages, compression, your diet. Those things you can control. The amount of swelling, you can't. That's your body's response to surgery, okay? So just focus on the things you can control and just let your body heal and give it time, okay? I'll take some questions now.
Yay! Well, my belly button seems to be shrinking as it heals. I'm 6 weeks post-op. Is that normal?
So belly button training is extremely important, okay? The belly button is a circle. Scars, how our body heals is by causing a scar, and then the scar contracts, okay? That's just our body's response to healing. Every single scar heals that way. When we have a belly button that's a circle, the scar contracts and it could cause the belly button to be smaller. So that's why belly button training is important. What is that? You can start as soon as 2 weeks out, and it's putting a marble or a silicone ball. If you go to Amazon, put silicone belly button trainers, you can find different shapes, different sizes, but it's basically putting a shaped ball, or sometimes it's like a little tube that you place in the belly button to avoid the scar to shrink too much. If you're 6 weeks out, you're still good time to start the belly button shaping, and try to put it every day, at least until 3 months out.
If I have an all mini tummy tuck, but you did lipo on me, can I retrain my belly button?
Yes, that's always possible. Belly button training is not as important on liposuction because there's not a scar there, but if you do have some skin, and it's gonna sag and cause what's called belly button hooding, which is the skin over the belly button kind of hoods over, and instead of having, I don't have the here. Instead of having a circle, the skin over kind of hoods. Instead of having a circle belly button, this skin over kind of hoods over, and the belly button shape changes and kind of flattens out. So you can put a marble to try to reshape that belly button and get the skin to contract upwards. Okay?
Okay. Wait, I need another hand. Can a reverse tummy tuck fix flanks and upper abdominal excess skin?
So the upper abdominal excess skin, yes. Okay. So what's a reverse tummy tuck? The reverse tummy tuck, it's basically if you have usually. Oh, okay, I did already that.
Okay.
There you go. So you have your abdomen. This is the belly button, right? And here's your breasts. Okay. So the reverse tummy tuck is only going to take care of excess skin in the upper abdomen. Okay. It's basically an incision that's going to mimic the one from the breast lift. The only difference is it's going to connect in the center and basically removing this excess skin. All of this, and pulls the skin up. It's not going to reposition the belly button. It's not going to fix anything lower than the belly button. So the majority of people are not a candidate. Okay, the usual excess skin pattern after pregnancy, after massive weight loss, is actually excess skin in the lower abdomen. It's very uncommon to have just excess skin in the upper abdomen. So it's usually not a very common surgery because the majority of people are not good candidates for it. But if you do not have any excess skin in the bottom, your belly button position is good, and you just have a little bit of hooding, you're a good candidate to pull it up and get rid of that excess skin.
Nipple fillers for people who want the Kendall Jenner designer nipple look. Protrusion.
So this is getting more and more popular as Kendall Jenner usually uses thin clothing, and you can see like the nipple shape through her clothing. People injecting fillers in the nipples. My advice, be careful, okay? Fillers tend to fill the space, but also the nipple has an ability to contract and retract, right? And when you're cold, responses to temperature, responses to sexual stimulus, you may lose sensitivity, you may lose shape, and it may become more sensible, okay? So just be careful with all of those trends, especially when you see it in social media only.
Okay. Another one. Hola, buenos días. Después de un tummy tuck, ¿al cuánto tiempo se puede hacer la lipo?
So, después de un tummy tuck debes esperar 3 a 4 meses para poder hacerte la liposucción. Queremos que todas las incisiones hayan sanado bien, por eso esto, ¿verdad? La mayoría del swelling de la inflamación va a bajar a los 3 meses, o ya usualmente para los 3 meses puedes volver y te podemos hacer la liposucción.
¿Decimos en inglés?
Yes. So if I had a tummy tuck, when can I have lipo? So the answer to that is 3 to 4 months later. Like I explained, the majority of the swelling is going to come down at 3 months, and all the incisions are going to be healed. So then that's when you can come back and get a lipo 360.
Okay, we have a patient that wants to join the live because she wants to know what surgery she needs. Let's explain her how to book a consultation with us.
So yes, it's important. The reason why I I'm not gonna do this is to protect your privacy, okay? It's very important that that we don't put any patient information, one, and also any advice, surgical advice specifically to your case in a platform like this one. It's not safe. Also, when you write to me through the DMs, I can answer like general questions, but if it's something specific to you or an evaluation with you, it needs to be through our HIPAA compliant or patient privacy compliant routes, okay? So very easy. You're gonna go to my page and there's gonna be a link, okay, to our website, pureplasticsurgery.com. You're gonna see there request consultation. You click that, it's gonna open up a form with several questions, very easy to fill out, and it's gonna ask for 3 pictures. You submit that, you give us 3 to 5 business days. I evaluate the information and your pictures, and a coordinator will contact you with my recommendations.
I'm scheduled to see you in July. I can wait. I'm trying to get a virtual consultation since I had weight loss.
Okay, so yeah, that's awesome that you're coming in. If you want to do a virtual consultation, just ask. If you did all the process already, I guess you did because you're coming in July, you can just contact your coordinator through Clara or give us a call and she can help you schedule the virtual consultation with me or in person if you're here in Miami.
Okay, can you please explain how to use the Silagen strip? Is it reusable and washable?
Yes, so very good question. So any silicone-based strips or tapes, they're reusable, okay? You can use them for a couple of weeks. It is important that they keep their integrity, right? If they start to chip or break, then you should change them. But usually a couple of weeks is good. And the importance of applying the silicone tape or gel, both, is that the silicone product needs to be in contact with the scar, okay? So if you put a moisturizer, if you put SPF or any sun protection, you need to wipe that out, okay? So wipe it out, after your shower, pad dry it, make sure it's very dry and you don't have any ointments over, and then you're gonna put the strips or the gel, okay? If it's a strip, you're gonna put your strip and you leave it 23 hours a day, which means you're just gonna remove it to shower, okay? And then you reapply it. You're gonna use it for 2 to 3 weeks or something like that. Once it starts to kind of chip off, you change it. If it's the gel, you're gonna massage it over the incisions twice a day. Same, okay? Don't put the moisturizer, don't put anything before, just the gel right in all over the scar, okay? Awesome. Okay, guys, so thank you so much for your questions. Thank you so much for joining. Hope this helps. Don't freak out about the swelling. Just let it be. Just trust the process. It'll get better. And if you have any questions, DM me, and I'll see you guys next week on Tuesday Tips.